Allô, Nissan? Hey, grosse tempête, hein?
Hey, Karine, oui, je sais, les vilains bonhommes de neige sont de retour.
Mais avec le Nissan Rogue à traction intégrale, c'est pas stressant.
Exact, il est conçu et testé pour nos hivers. Oh, Karine, il y a un bonhomme dans le Rogue.
Ah, c'est correct. J'ai allumé les sièges chauffants.
Ah, bien joué, Karine. Maîtrisez toutes les conditions. Louez le Rogue S 2026 à partir de 0,4% jusqu'à 36 mois, incluant une réduction fidélité de 0,5% pour les clients Nissan admissibles. Jusqu'au 2 mars, sur approbation de crédit, les conditions s'appliquent. Détails chez Nissan.
It's hour 2 of the program. For this second hour, we continue our special COVID-19 coverage and answering your health-related questions. Of course, just want to point out before we get into it that, we're relying on the best knowledge we have right now, right? COVID-19, this is a fluid situation. So what we're doing here, and boy, do we ever have the right doctor for it, but we're trying to answer your questions with the best possible available information we have at the moment. It's Dr. Don Vihn that joins us this morning, MUHC infectious disease specialist, a medical microbiologist, and also a clinician-scientist at the Research Institute of the MUHC. Dr. Don Vihn, I thank you so much for coming on the show.
Good morning, Elias.
So can I ask you before we get to questions, because honestly, I just want to know how you are doing, how you are holding up, how your colleagues are doing. Tell me just how it is right now.
So I'm going to speak on behalf of my colleagues. We're going to war every day. We're the nurses, the inhalational therapists, the pharmacists, the physicians, the ambulance, everybody. We feel we're going to war. We have to pace ourselves because we're risking to get weary here. We're risking battle fatigue.
Yes.
And we need everybody's help to understand that this is a serious problem.
Okay, but you're confident in the healthcare system right now, right?
Absolutely.
Yeah, okay, good. Before we get to the lines, we're taking your calls at 790-0800 and your texts at 514-800. Dr. Vihn, I want to do rapid fire.
Yeah.
Some of the questions we've gotten basically every day since we started this last week, okay? So I want to nip these in the bud, okay?
Yeah.
So let's try and do these quickly. Can I get COVID-19 twice? After I get it, I recover. Can I get it again?
We don't think so.
Always asked as well, gloves and masks, if I'm going to the store, if I'm going out, useful or not?
Not usually.
And also always asked, should I cancel this medical appointment? I have this medical procedure coming up. Should I cancel it?
That's to discuss with your physician about how essential it is.
Perfect. So hopefully we can nip those in the bud, and I'll try and do a refresher on these every few days.
Good idea.
Okay, let's go to the lines now. We're going to kick things off with Anna. Hi, Anna. What's your question?
Hi, I have a question for the doctor.
Yes.
My health is compromised because I had a surgery 2 years ago to remove cancer from my lungs. Okay, so I have 20% of my lungs removed. Now, I'm dealing with my mother, who's an elderly lady, and she's fighting her own battles. Now, I need to care for her. When I go see her, because I have to go see her, I wear a mask and I wear gloves. That's it. Am I doing okay?
Those are difficult situations to be in, so we completely sympathize with you. First of all, you have to make sure, at the risk of sounding selfish, that you have to protect yourself. So that really means that you are not around anybody who can transmit something to you. And since it's hard to know who that is, that's pretty much anybody. Make sure you keep that physical distance, hand hygiene, nobody coughing or sneezing around you, and you cough or sneeze into the crook of your arm. When you go see her, because it sounds like your situation is you must take care of her, you have no other alternatives. Of course, the first choice is that you can get alternatives. If there are other people in your family or other types of help that you can have, I would strongly encourage that. But in the reality, that may not be the case, and you need to make sure that you do everything you can to make sure you don't transmit anything to her.
Would it be advisable, doctor, to take her home with me? Because I really want to do that.
I don't know where she lives now, so it's a bit particular, your condition.
How do you mean?
Like, where is she, Anna? Where does she live? Is she?
She lives in her own house.
In her own house. Well, I don't know. I don't know her living condition. I don't know your living conditions. That's a bit difficult. If you think that you're going to be around other people are going to frequent your house, then you will unfortunately be also exposing her in the process.
Oh, okay.
If you find that it's completely unsafe for her to live in her own place of residence, then you do have to risk that balance as well. So it's a bit particular, your condition.
Okay, because there's only me and my husband at home. My son volunteered to live outside the house. He's 24. So at the end of the day, there's only myself and my husband. And I said to my mom, just come home with me and I'll take care of you here, and that's it.
You know that may be an option, but again, it depends on how safe you feel that she is where she is currently, and if you feel that she can be safer with you. You know, if you feel that she's at risk for falls or that there's no way to communicate with her if she lives alone, then you may have to accept that, and then you collectively become one household where you have to make sure that you keep people on the outside.
Okay, I appreciate it. Thank you.
Okay, Anna, thanks so much. Doctor, just as a little bit of a follow-up to Anna's question, and I think maybe it can provide some insight to a lot of people who are grappling with the same kind of question. When it comes down to it, are we basically just trying to lower the percentages? Like every decision we make, should we live here? Should someone move in? Like every decision we make from this point on, it's all about reducing the percentages of how transmission can happen?
Exactly, Elias. You're right. We're not... Unfortunately, there's no black and white situation where we'll have 0 or 100% transmission. And we also don't live in a bubble where we say, okay, well, you keep your mother in your residence all by herself. She's 95 years old, and because that's not realistic, and that may not be safe either, right? Mm-hmm. We have habits, and now our habits are abruptly broken, and we have to adjust, and we do have to do a risk benefit. Like you said, we're not going to bring it down to 0 immediately with these measures. So we have to try to choose the least of all evils, you know?
All right, let's go to Oksana, who's in Lorraine. Hi, Oksana.
Hi, doctor. A question. My mother is 92 years old. She's living in a residence, an autonomous residence. There's no services. I cannot go and see her. She's been complaining that she has now, for the past 2 weeks, a little bit of heaviness on her chest. And from time to time, she would just kind of cough a little bit. But I've noticed, through talking with her very often, even today, her cough has been getting a little bit more often than usual. She does, from time to time, she has a little bit of problem with her lungs because she has been prescribed Flovent and Ventolon. She's taking the Ventolon, but I don't know whether she should take the Flovent. To what point should she be coughing, or for us to call 911 to take her to the hospital, or she should stay there until something serious happens?
Well, so you bring up a few good points. First of all, she's on what you mentioned is Flovent and Ventolin, which it sounds like she has some sort of reactive airway disease. So in general, people should not stop any medications that they have been prescribed. Okay, so if she's been prescribed that, she should continue that. The only reason she should ever stop it is in discussion with her physician who prescribed it. So that's just a general rule. The other thing that you mentioned that has me a little bit concerned is you're talking about she has heaviness in her chest and she's having some trouble breathing and maybe some cough. Don't forget that even though we're always talking about COVID, people can also be sick from a variety of other reasons. Some of them can also be serious. And if she's having heaviness in her chest and trouble breathing, that certainly warrants an evaluation if this is all new. Why? Because it could be a sign of another problem, for example. And I don't mean to have you unnecessarily worried, but it may involve her heart. It may involve her lungs, like she may have something else cooking in her lungs. So
her voice is strong. She's walking around. She's cooking. She has no temperature. She did go out this morning just to get a breath of fresh air. She says she feels better when she has, some fresh air. Otherwise, I said, just open up the window and try and breathe the fresh air that's through the window so that she could stay put in the house. Right. The Ventolin and the Flovent, she was prescribed from previous times that she had. She does not take this regularly, but I told her to take the Ventolin. When she takes the Flovent, she took it once and she found it a lot more heavier on her chest, so I told her to stop.
Okay, so maybe now is not the time to answer all those details, but as a general rule, if you find that for people who are taking care of their elderly parents, it's always a difficult balance, right? Do you want to keep them safe in their place of residence, but you don't want to keep them isolated?
Because I'm not allowed to go there.
Care?
Yeah.
So what I would suggest is if you think that there's any change in her normal status, that the heaviness in her chest gets
Worse.
more, her breathing gets more difficult, her coughing becomes more. Anything that is different from usual, I would say that requires some vigilance, and especially given her age, a low threshold to seek medical care if necessary.
All right, Oksana, thank you so much for the question there. Doctor, I'll give you one quickly here, and it provides maybe a little bit of levity, okay?
Yeah.
Super awkward question. Is the virus transmissible through making whoopee, having sex, and that? Now, to me, doctor, it just seems like if you're going to have sex, you're going to be making out and kissing, so we know it's transmissible there. The stuff that happens before the actual sex is the issue, right?
You're absolutely right, Eli. So in fact, this is actually a recurring question, which is not unexpected when people are in quarantine or self-isolation, I presume. But there's sort of two questions here, right? One is, can it be transmitted through genital secretions, let's say, for example, like HIV? And the answer is there isn't enough data to suggest that, although again, we don't have the data. But like you mentioned, there are other ways that it can be transmitted during intimate contact, like direct contact, kissing, transfer of saliva, that kind of stuff, heavy breathing. And so those can contribute as well to transmission.
And, from everything I know through my years on this world, it is very difficult to do it while following the 2-meter advice from the government.
Unless you're well endowed, I guess.
Yes, Dr. Vihn with the greatest line of the morning. All right, we're back here with Dr. Don Vihn, who not only knows his health, he knows his infectious diseases, he also has a great one-liners sometimes. Thank you, Dr. Vihn, for coming on the show. I love that line. I may just loop that and play that at other times during the show. Okay, question from email that I got, and this could be another one that we deal with quickly. Produce of Spain. Somebody is saying, hey, I'm at the grocery store and it's they got the clementines and they're a product of Spain. Do I need to take precautions?
Not any more than usual. So if they're fruits and vegetables, they should be washed. If they're uncooked meat products, they should be cooked.
Very good. Excellent. Let's go now to Lisa in Chateauguay. Hi, Lisa.
Good morning.
Morning. What's your question?
I've got very mild, if not asymptomatic MS. I've never been on any medication, nor am I now, and I want to know if I'm more at risk being an autoimmune disease carrier.
So you ask a great question, because we're trying to understand, we in the medical community are trying to understand who are the people at risk. We know, based on the rest of the pandemic that's gone on so far, is that elderly people are a big category, and people who have underlying heart disease or lung disease or kidney disease are another category. But people who have immune problems, like autoimmune problems, or they're on medications that weaken their immune system, or they're transplants, we don't actually know yet. We're actually trying to collect that data to understand that. It doesn't look like people with multiple sclerosis or autoimmune conditions like Crohn's are at risk, are at increased risk, I should say, not more than the general public. But again, we don't have enough data.
Okay, great. Well, thank you very much. I'll wait for the news.
All right. Thanks so much, Lisa. Appreciate that. Another question here, doctor, on the text line. My husband has cancer. We've been quarantined for over 2 weeks. Am I compromising his health? Should I leave? ?
So again, those are very difficult situations to answer practically. First of all, our thoughts go to you. Anybody who's dealing with cancer, especially during this time, is not easy. There are different types of cancers, and there are different types of chemotherapies or other types of therapies that people can get for cancer. All of them may or may not affect our abilities to fight off this virus. There's also different risks for that person, the partner who's answering the question, who's asking the question of whether or not that person may be at risk. So it's a little bit difficult to answer. In general, if neither of you are having symptoms and you are adhering with the standard measures of the distance and the hand washing and all the other hygienic measures, you should not be at any more risk than usual, but you should not be inviting people into your household unnecessarily.
Okay, so let's go back to the lines. We're going to get to Ted in Il Perot. Hi, Ted.
Hi, good morning, guys.
Good morning.
Hello. I work in an essential service, okay, but I've been at home for the last 2 weeks self-isolating. I have COPD, asthma, and nasal polyps. And I'm kind of getting pressured a little bit to come back to work. I mean, I'm on Symbicort, Spiriva daily. I do have Ventolin as well. I'm staying home on my own dime. I mean, they're not paying me or anything. Is it safe for me to go back to work? I mean, I work in an office, and just being out there, I mean, I've only been out of the house once to get groceries, and even that kind of, I was a little freaked out.
Right. So maybe I can help alleviate some of your anxiety. We don't think that nasal polyps is a major risk factor for severe disease. What may be a factor for you to consider is your lung disease. You're on several medications for that, and I can't tell about the severity of your lungs. I also don't know the type of work you do. I would strongly suggest that you have this conversation with your supervisor and explain the situation, and perhaps they can reallocate you to an essential service that doesn't put you at as much risk. I do want to make sure that people understand that we should make a distinction between a respectful fear of the situation and anxiety, right? Anxiety can lead to panic and loss of control, and a respectful fear means that we respect this COVID enemy and we do what we are instructed to do to try and beat it. And I would strongly encourage everyone out there who's listening to forget about anxiety. That's not going to help us, but to have a respectful fear, to have open conversations, in your case with your supervisor, to find out if there's a way for you to contribute your essential service, but in a perhaps a more environment that perhaps makes you more at ease.
Okay, Ted, thanks very much for the call here. Doctor, here's a question from the text line, and I think maybe there are a lot of people in this situation. So the question is, can my in-laws, who are high risk, obviously they're probably older, they got some medical conditions, they're high risk, can they come stay with us after each of our families self-quarantine for 14 days? We have 2 kids. So you've got the in-laws. They're alone. You've got the family unit of 4, right? They're now living in separate homes. If both of these families wait it out, they quarantine for 14 days, can then those in-laws come to the family of 4 and then become a unit of 6 in one household? What would you say?
So that requires a drawing board, to be honest with you. I mean, it's a bit convoluted, but my bigger question is, why is that even necessary? If your in-laws are mobile, I presume that they're relatively well. The safest thing to do for people who are well and mobile is to stay home. This is not the time to start relocating and changing postal codes, unless there's a medical reason to do that. But if this is a social visit, this should not be considered an opportunity to bond either. I make that very serious. The goal here is to isolate and minimize movement into and out of households or into and out of the public areas unless it's essential. And so unless there's a compelling reason to do this intervention of merging households, I don't see the need for that.
Yeah, doctor, I think you're making a lot of good points there. Okay, we're gonna answer one more question here, and let's go to this. I like this question, doctor, because I think a lot of people are also dealing with this. So there's someone who sent me an email, and they go to the pharmacy and the disinfectants are sold out, the rubbing alcohol is sold out, and we're being told to clean surfaces and that kind of stuff. What are some of the alternatives we might not be thinking about in our own homes that can still provide that protection when it comes to cleaning surfaces if we've tried to get supplies and we can't?
So when you clean a surface, we do try to aim for disinfectants, but soap and water works very well. Mm-hmm. If you have any type of soap, and I mean soap like, dishwashing detergent, those sort of...
Palmolive or whatever.
Exactly,
yeah.
Exactly. Those work well. Soap and water is fundamentally well, and you can use that. Obviously, you have to be a little bit careful in terms of using certain soaps or certain surfaces, including your hand soap. Don't use industrial soaps or cleaners for your hands, but you use it on the appropriate surfaces and they should work. You don't need to go out and buy the industrial strength Lysol or equivalent to clean off your countertop when that's not what you've ever done before. You can use your standard measures of soap and water to regular clean countertops, doorknobs.
I think that's some very good advice for a lot of people who are struggling with that. Continuing with Dr. Don Vihn, MUHC infectious disease specialist, also a medical microbiologist and a clinician-scientist at the Research Institute of the MUHC. He's got the resume, and he's answering your questions. And Dr. Vihn, we actually have another doctor on the line who's calling us from Miami. We're going to, is this Dr. DiPietro?
Yes, speaking.
Hi, doctor. Can I ask you, are you a doctor from Montreal that's spending time in Miami, or
No,
you're based in Miami?
Yes, I've been here since 1982. I actually was born and raised in Montreal, trained in Quebec, did my residency at McGill, and then moved here in 1982. And I'm, board certified in anesthesiology and internal medicine, and I've been practicing here since 1982. So as an ex-Montrealer, I kind of understand both systems, even though things have changed over the years.
Yes.
But what I wanted to bring up is that a snowbird from Montreal came to see me, a 68-year-old woman who had a bone marrow transplant at Maisonneuve Hospital. She's been cured of her AML, which is a form of leukemia. She's here. She spends the winter here. She's due to go back on March 31st, and her Quebec Blue Cross ends March 31st. Now, this COVID-19 came up. She's safe. She's living in a single-family home with her relatives. She's safe here and she's well. But Quebec Blue Cross wants her to travel back home, and I'm not recommending that. I'm telling her, listen, the act of traveling back home, going through two airports, traveling in a packed, airplane where you may have somebody with COVID-19 is a risk that you don't need to take. I am recommending she shelter in place for 30 more days till the end of April. The patient is happy with this. She's actually afraid to travel back. But, Quebec Blue Cross says, no, I'm sorry, unless she has COVID-19, we're going to tell her to travel back or her insurance expires March 31st, which I think is very unfair. And I wanted to ask Dr. Vihn what he thought of this, because the act of traveling is the great danger, in my opinion. We shouldn't take it lightly to go into an plane or going to an airport. We're having a problem here with the New Yorkers, which is the epicenter. They're flying down to Miami and they're bringing COVID-19 here, and we're up to 375 cases now in Miami, many of whom are hospitalized. So I'd like to know what Dr. Vihn thinks of all this.
Yeah, so I'm going to be honest with you. This is not an easy question. So first up, there's two perspectives, right? There's a medical perspective and there's the administrative perspective. From the administrative perspective, I can't speak to her insurance policy. As you know, that's between her and her insurance, the insurance company, and there is a context, right? That flights coming back to Canada are decreasing. They're less and less frequent, and I don't know. At one point, it's even theoretically possible there may not be any for a while. So there's that issue. But from a medical perspective, there's a few factors to consider. When was her bone marrow or stem cell transplant? Has she had any complications? Is she on any immunosuppression? So there's those factors. And then there's the other factors about what are her risks. There are the risks of not only travel, like you said, going through at least two different airports, depending on her trajectory, but also what is the risk of a travel related acquisition versus a community acquired acquisition? As you know, the community transmission is occurring. I don't know what the numbers are exactly in Miami. I know you said 300 and something, but I'm not sure how accurate that is. And in Quebec, for example, yesterday there was 1,013 cases that were positive, and that's a significant increase. And so there are those factors to consider. Is her risk of staying there in Miami and getting a community acquired and having a community acquisition higher than if she were to, travel and come back? And those are not easy to answer. I would agree with you that the path of minimal risk is the best, but I'm not sure we have enough data to know what that is. If there's a way for her to have some sort of private travel back, the same way some of the other Canadian citizens were repatriated from other countries, that may be potentially an option. So I would consider all those factors.
This is such a complicated question here, and Dr. DiPietro, before I get back to you, latest stats we have, and J4R looked this up: 367 confirmed cases in Miami. So I want to ask you, Dr. DiPietro, what's the faith you have in the American and the Florida healthcare system to handle this when a whole bunch of people are getting mixed signals south of the border on social isolation and going out? My gut reaction is get back to Canada, especially if your healthcare is going to run out.
Yeah.
Well, that's true, but I could tell you that social isolation has been working here in Miami. All the beaches have been closed. Restaurants are, closed. As of midnight this morning, the city of Miami has, instituted a shelter in place. So people have to remain home by law, or they're subject to, 60 days incarceration and a $500 fine. So this is working, and particularly for this patient here, this Canadian, she's in one of a relative single-family home with a swimming pool. She's sheltering in place. She's absolutely safe. She's feeling well. She's having groceries delivered by Instacart, so she's safe. And here we have Blue Cross that wants to force, because the patient's not going to stay if they don't have insurance, because they're too afraid of getting sick. But I think Quebec Blue Cross should make an exception and prolong these contracts for all these snowbirds that are here, because I'm sure there's many, many other patients like this that are stuck here. And I've heard of people that have driven back, and there's no restaurants, the motels are closed, you only have gas stations that are open, so it's not easy driving back to Montreal from Florida either.
Go ahead. It's tricky. I'm saying it's, that's a tricky question to ask, but at the same time, looking at both healthcare systems, I don't know. I think, and the government, the federal government here in Canada, it's been over a week and a half where they'd been passing the message, get back home. And so if the federal government's saying get back home to all of its citizens around the world, I find it hard to sort of put the blame on the insurance company here. But
I agree.
Well, my point is the act of returning home cannot endanger you if you have an immunodeficiency because you've had a bone marrow transplant 5 years ago. It was a real success story in Quebec. A patient tells me it cost her nothing. She spent a year in the hospital, but she's cured, and her doctor, unfortunately, is not available because she's been sick herself, and there was a suspicion that she had COVID-19. Imagine that. So she's not able to call her oncologist at Maisonneuve, and here she is in Miami and asking me for my advice, and I've told her my advice: stay here another month and get the insurance company to extend your benefits for those 30 days, and then we'll revisit that in 30 days.
I have to move on, but Dr. Vihn, give me a few extra comments here if you can, so we can wrap this up.
I agree with you. I think the federal government has really issued an advisory, which is every Canadian should come back. We know the healthcare system here. I can't say that I know the healthcare system in Miami, and we know how prepared we are. Not as a criticism to anywhere else, but I just know what I know, and so I understand the call for people to come back. I understand the concern. She's safe here. Why risk it? The question is, how sure are we that she's safe there? I don't know the data in Miami, and I don't know how accurate what's going on there.
Dr. DiPietro, I just want to thank you for having the insight to give us a call. That was a really interesting discussion regardless.
Very good. Happy to talk to you. Have a good day.
Okay.
Stay safe.
Take care and stay safe in Miami as well. All right, Dr. Don Vihn from the MUHC is on the line. Doctor, got a text message here from someone who tested positive for COVID-19. We reached out, tried to get them on the phone. They say they're really bad on the phone, so they prefer to do this via text. So I've tested positive already, and it's already been 11 days. The fever is still on and off, 99, 100, 101 Fahrenheit. Is this something to be worried about?
As long as it's just a fever, that's not a problem. If the fever is bothering you, please, if there's no other what we call contraindications or reason you cannot take this medication, you can take Tylenol. If you've never had any problems with Tylenol before, try to avoid things like Advil or ibuprofen for the moment, because we don't know if there's some data that's not very clear, which may influence how severe the disease can be, and keep an eye out on your breathing. Keep an eye out on those sort of things. If you find that you're having trouble breathing, then you should seek medical attention. This is not unusual. There are some people that the illness can be a little bit more prolonged. It's kind of like the flu or the cold. Some people recover quickly, and some people are a little bit slow to recover. And so I would just keep an eye on that. If it's just your temperature that's taking a little bit longer to resolve, that's okay for now.
And doctor, just a little bit of a follow-up here, because I've seen some comments about why people who are sick that have COVID-19 are being told, stay at home, deal with it at home. The Quebec government's self-care guide. Why is that so important that someone that is in a situation where all they've got is the fever, they have a mild symptom, just stay at home in isolation as opposed to going into the hospital?
So there's two reasons. One is if you are COVID positive, so you have a test that's COVID and you have symptoms, what we definitely do not want is for you to be very sick and you're stuck at home, but we also don't want you to be transmitting to other people. Remember, there's two aspects to the distancing and the isolation. One is to protect yourself, two is to protect other people. If you are COVID positive, your role will be to make sure that you do not transmit to other people who may have a severe complication from this. You're also supposed to make sure that you're okay. If you are not having trouble breathing, if you're just having a little bit of fever and maybe a little bit of aches, and you can tough it out at home, that's great. And the reason we don't want you to be in the hospital is because the hospital or healthcare capacity is overrun. And we need to really keep the healthcare capacity to the severe cases of COVID, as well as people who don't have any COVID, but other medical problems.
All right, let's go to Jennifer, who is in Lachine. Jennifer, you work at a daycare?
Yes, I do.
And you're still up and running?
The daycare's been closed, and then they just opened it for only health workers, children. Mm-hmm. And I worked one day last week, and there were just two little brothers there that I was with. So I'm going to be there tomorrow, and my question is whether I should wear a mask or not. I'm going to be not in social distance the whole time, and that's my question because I didn't want to alarm the kids. Like I didn't want them to get, kind of scared about that, looking at me with a mask on.
You're right. So, working in the daycare with a mask is not at all appealing for kids unless it's Halloween. You have to understand that if you're wearing a mask, there's two reasons anyone should wear a mask. You think that bodily fluids are going to splash in your face, or you have respiratory symptoms. If you think bodily fluids are going to splash in your face, I'm not sure what's going on at daycare, but that's not normal. So the other issue would be that you have respiratory symptoms. If you have respiratory symptoms, you should not be working. That is for sure. You should not be potentially transmitting to others, but it will not protect you. And if you have somebody in your daycare who is COVID positive, they should not be there either. And that also applies to children. So I hope that clears it out a little bit. You don't need a mask as a general rule.
All right. The other question is, should I wear surgical gloves, which they give us, to do changing diapers kind of thing? Should I wear that the whole time? Or that's a possibility I touch my face with the gloves on? Right. I was washing my hands with the gloves on. I got confused completely. I didn't know,
So you've worked in this daycare before?
Yes.
Right. So what do you normally do when you're dealing with changing of diapers?
So normally the routine is you don't wear gloves unless you're changing the diapers or feeding the food, and you throw them out immediately following.
That's your usual routine, right?
Right.
Okay. That's fine. There's no reason to do anything extraordinary here. I've had kids before, and I've changed my kids' diapers or the diapers of other kids. I've never worn gloves, but I absolutely wash my hands afterwards, and that has nothing to do with COVID. And so I would just make sure that people don't worry about doing too much heroic measures, just the standard hygienic practices. If what you normally do is to wear gloves when you change the diapers and you dispose of your gloves appropriately and you wash your hands afterwards, then by all means do so. Do you absolutely need to wear gloves? That's a policy that your daycare seems to have. But just don't worry about doing anything more than that.
Okay.
Thank you very much for the call. Let's go to Bill downtown. Hi, Bill.
Hi, I was sent a message back in February from my pensioners group. The Quebec Blue Cross provides an automatic extension of travel insurance coverage for clients placed in quarantine due to the outbreak of the new coronavirus and whose policy was in force on the day the quarantine began. Coverage is extended for up to 72 hours following the end of the quarantine period until the insured person returns to their province of residence, whichever occurs first.
Uh-huh.
Now, that's from Regional VP of Travel Insurance Blue Cross. So if that doctor keeps a careful eye on the lady and maybe detects some symptom that he thinks is, a sign of the virus, and he puts her in quarantine before March 31st, she's covered until she comes out of quarantine. I'm not suggesting anything, a loophole, but...
Yeah, no, I mean, that could provide a few extra days or a week of coverage if there is a quarantine order from a doctor. So thank you so much, Bill, for that added insight. Let's go to Beverly in Verdun. Hi, Beverly.
Hi. Yeah, I am 83 years old. I am supposed to go for an iron infusion, an iron IV, for the next 3 weeks. I've had one already. I'm due on Friday for another one. December, I had bacterial pneumonia, septic shock, a heart attack. I'm COPD and diabetic too. Should I go? Because my doctor's saying because it's chronic, I have to go. My hemoglobin was 80 I had my blood test the 5th of March, and I saw my doctor the 13th, and it's a case of you go for the next 3 weeks, the 16th, 23rd, and 30th. My other one is coming up. I canceled on the 23rd. My other one is coming up on the 27th. And I'm concerned because I'm going to be in contact. It's at the CLSC. And I'm going to be in contact with the technician or the nurse that's going to administer it. Yeah. This is not something that's 5 minutes, like 3 hours.
Beverly, let's try and get Dr. Vihn's insight because we're running out of time here. Dr.
Yeah,
Vihn.
so that's a bit of a difficult question. I would strongly suggest, first and foremost, you discuss that with your physician who has prescribed the iron and see if there's an alternative way that you can get the iron. For example, pills. If it's absolutely critical, then you should inform your physician about your concerns and perhaps an alternative place of infusion can be arranged. I don't think you're concerned, though, about being next to a nurse. Infusing it for a few hours is your major concern. Of course, it's not impossible that the healthcare worker can transmit to you or vice versa. But if you're doing it in a CLSC where there are other potentially sick people, that may be a strong factor to consider. So I would look at those three things to see if there's a way to address your concerns.
All right, Beverly, thanks for the question. One last one. Let's try and squeeze this one in. My son is 12. He has cirrhosis of the liver. Platelets are stored in the spleen. Low immune system. Do I keep him in a separate room from me and his brothers?
If there's nobody who is symptomatic, who has respiratory tract infection symptoms, so runny nose, sore throat, cough, fever, and diarrhea now as well, that's another symptom. Mm-hmm. If there's nobody who has that in the house, then there's no reason to isolate him from everybody else in the house.
All right. Dr. Vihn, you are such a terrific resource. I want to thank you for taking the time, okay?
You're very welcome.
That's Dr. Don Vihn from the MUHC, infectious disease specialist. And again, we'll take another crack at this tomorrow in the second hour as well.